So much. We turn now to the growing concern for Kanye West. He's been making a run for president, as you may have seen, but after his campaign event over the weekend where West promised $1 million to every American who has a baby and was visibly distraught while speaking on a variety of topics, he's since gone on Twitter and gave us one of his classic rants. And this one was redirected at his own family. And now the family is speaking out about his mental health struggles. His wife, Kim Kardashian West, took to social media with a statement where she addressed Kanye's bipolar disorder publicly for the first time today. And she said in part, and I quote, "Those that understand mental illness or even compulsive behavior know that the family is powerless unless that member is a minor. People who are unaware or far removed from this experience can be judgmental and not understand the individual themselves have to engage in the process of getting help, no matter how hard family and friends try. I understand Kanye is subject to criticism because he is a public figure and his actions at times can cause strong opinions and emotions. Living with bipolar disorder does not diminish or invalidate his dreams and his creative ideas, no matter how big or unobtainable they may feel to some. That is part of his genius, and as we have all witnessed, many of his big dreams have come true." I want to bring in now to talk about Kanye and his unique position as we try to move this conversation forward on mental health, pop culture and media commentator Jawn Murray, as well as Dr. Damon Tweedy, psychiatrist and author of Black Man in a White Coat, a doctor's reflection on race and medicine. Thank you both for joining us. Jawn, let me start with you. What was your reaction to Kim Kardashian West's statement?
TJ, I think that statement was needed and necessary today because here's the truth. I've had some of my funniest and wittiest lines on TV poking fun at Kanye West and Kim Kardashian. They're big personalities, so they're very easy targets. But all jokes aside, I've been really disappointed with the media coverage of Kanye over the last few days because we know in 2016 he had to go into a health facility for treatment after having a manic breakdown in public. We all saw the 2018 interview on TMZ where he had the erratic behavior and Van Lathan so brilliantly had to challenge him about his mental health. And so while Kanye is good for headlines, he's good for sound bites, he's good for clicks online, not putting his mental health and his wellness at the front of those stories, it's a disservice to the audience, it's a disservice to Kanye, and it lacks a level of sensitivity. And I'm glad Kim is saying, please have some compassion for him because this is not business as usual. This is a man who doesn't even know the condition that he's in.
Well, Jawn, we seem to, like you said, an easy target, but sometimes people are quick to just roll their eyes, or that's Kanye being Kanye, or, you know, he's rich and he's an artist, so he's a little eccentric, and dismiss it. Did she now, with her statement, change that narrative? We're getting it from somebody else in a very compassionate way.
Absolutely, because, you know, there are people online right now, TJ, who says, oh, this is just a promotion for an album, or they're just trying to drum up a new storyline for Keeping Up with the Kardashians. But this is a man who is unwell, and we have to take that seriously. You know, if Kanye doesn't get the treatment that he needs, and if we keep gaslighting these emotions and thinking that he's just acting out, this could be the modern day story of a Phyllis Hyman, of a Donny Hathaway, a Whitney Houston, or Amy Winehouse. We have to make sure that this isn't just us using him for media attention or entertainment fodder, that we have to be concerned about him as a human because this man clearly needs our help.
And Dr. Tweedy, take us to a little mini med school here. We hear bipolar disorder all the time. We think maybe we understand what it is, but give us a kind of a little brief here about exactly what we're talking about and its impact on the body, the brain.
Yeah, so bipolar disorder is very serious. And the old term for it was manic depression. And it might be easier for people listening to sort of understand if you think about it in that way. Really, the mania and depression are states of mood that really impact how we think, how we feel, and how we act. So depression is a little bit easier to kind of understand. It's where people feel sad, they feel hopeless, they may isolate themselves, and just sort of overall, just sort of maybe even have thoughts of hurting themselves. So that's sort of the sense of depression, and that's actually more common among people who have bipolar disorder. They're much more likely to have that sort of an episode or presentation. But what gets more attention, of course, is when they have these manic states. And so the mania is what we talk about when someone, and what it typically means is that this person has abnormally, the mood is abnormally elevated, is irritable, they're very hyperactive, they have these sort of grand thoughts that are really out of character for what that person might normally feel and think. their speech and their thought patterns are really hard and difficult to follow at times, and they may become very impulsive and risk-taking. And so you put all those things together, and over a sustained period, it can certainly cause a lot of harm to the person and the family members as well.
And doctor, I know it's difficult to diagnose from a distance, but from what we are seeing from him publicly and have seen from him at times over the years, does he fit that bill?
Well, so certainly as a psychiatrist, I don't personally know him, and I certainly, can't make that diagnosis myself from afar. Certainly some of the things that we're seeing fit the descriptions that I just described for you. But, there are always other factors to consider. And so if you were doing an evaluation of the person, you would have to do a medical assessment and assess all sorts of other things. But certainly some of those symptoms do overlay with what we think of as symptoms of bipolar disorder.
And Jawn, we hear it plenty, right? As soon as he talked about the presidency, publicity stunt and upcoming album, and he had no real path to the presidency, sure. But was there anything that he could have or could still contribute to the public dialogue?
TJ, if you have millions of dollars, you can run for president of the United States. I mean, how many billionaires had failed attempts at the presidency this time around? And you don't have to take a mental competency test to fill out the FEC paperwork to run for president. And, some would say, looking at the climate in our country, mental wellness, you can go into the White House and not be capable. But I will say this, Kanye, this whole presidential situation, I think maybe it is going to serve a greater good. Maybe it's going to evoke a conversation about mental wellness, because that is what we're seeing in this moment. You can consume his shoes and his clothes. You can love his music. But this isn't so much about the political landscape. This is a message and a moment that people can learn about mental health and fight to help a man save his life.
Dr. Tweedy, in her statement, Kim Kardashian West mentioned that he has the pressures of being a celebrity, also pressures of being a black man. That part, being a black man, how does that impact diagnosis and also treatment in the black community?
That's a great question. So in a number of ways. But one is that there historically has been a stigma. There's a societal stigma, and we've been talking about that towards mental health conditions. But in some ways, it's been more accentuated in the African-American community for many good reasons. And there's a lot of fear and mistrust about the healthcare system and what they might do. So one of the things that often happens in practice is that black people who present with symptoms of mania or bipolar disorder may be more likely to get misdiagnosed as being thought they have a substance use problem, or that they have schizophrenia, which is a even more severe type of mental illness. So it's often difficult to navigate the space of diagnosis. And then even once you get into the treatment relationship, finding someone that you can trust, who can provide the sort of resources and grounding that you need to manage that condition. It's all very complicated, and it's more complicated being an African American for sure.
And last couple of things here. One question to each of you. Jawn, first, and this is not the priority now, of course, but still, as famous and successful as he is and has been, what impact does this have on him going forward as an artist?
Listen, we know that Kanye has admitted that he's off his meds, and he doesn't like to take his meds because he feels like it impacts his creative process. And while he recently put out a Jesus is King gospel album that was very well received, and we know that people who battle mental illness can also function to be very creative and do great art. And so I think that if he is, mentally regulated and he gets into a healthy place, he can function, continue to be a great artist, with fashion and all the other things that he does. But his wellness and his ability to live a healthy life in society has to be the priority.
And Dr. Tweedy, last thing to you. Again, Kim Kardashian West said in her statement that the individual has to engage on their own to get help. Do you find that that absolutely is the case? And we're talking bipolar disorder and oftentimes mental illness. And how does one go about getting help or helping themselves?
So, so in the short term, sometimes treatment can be sort of forced upon someone, and that can take the realm of law enforcement and things like that. But in the long run, and if for someone to really get to wellness, that person does have to be engaged themselves. And you can't force someone to, take the medication or to engage in the types of behaviors that need to be healthy. So, yeah, the individual has to be able to access that. It's really important to have the family support, which sounds like in this case is the first step. That's extremely important to help ground that person as they move forward. And then they have to identify a trusted provider or practitioner who can really help them navigate that space as well.
All right, Dr. Damon Tweedy, Jawn Murray. Gentlemen, thank you both for being here. An important discussion. Yes, Kanye West could possibly help us move this conversation forward. Thanks to you both.
My pleasure.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.